Hey everyone, how are you? Sorry for being late in the live session again. So आज का जो live session है वो है difference between gynecomastia and pseudogynecomastia पे. तो see gynecomastia as such also we've made so many videos, we've done lives also, and it's a very common problem. And we have so many videos on our channel as well. Hi to everyone. Hi to all of you who've joined me now. Thank you so much for joining me in the live session. So today we are discussing about gynecomastia. It's a very common problem among males of all ages, I would say, even younger males, older males. Just now, the last consult that I saw was of a gynecomastia. And Dr. Sahil and me, we both were examining the case. Dr. Sahil is here. So I was just, speaking to them about how common a problem is gynecomastia, and that the last patient we saw was a gynecomastia.
Hi everyone, I am Dr. Sahil. I'm also a plastic surgeon and working with ma'am at SB Aesthetics.
So you must have seen Dr. Sahil and you'll see him more now. All right, so see, so many people are joining us already. And so I was telling all the viewers that how common a problem is gynecomastia, and we are always almost every day we are seeing
one or two
patients every day coming to us for this problem. And you see, actually a lot of time people think that surgical solution should be the last option, but here we don't have an option. Surgical treatment is the only option. And I think, Dr. Sahil, will you like to just elaborate about what is gynecomastia and pseudogynecomastia and how we can, what kind of problems people present us?
So basically, gynecomastia, true gynecomastia is an abnormal presence or enlargement of breast glands in a male patient, in a male. And it is physiologically commonly found in case of teenage years. And it is physiologically normal in case of infants and in extremes of age like old age. But if the gland enlargement persists after teenage years into the adulthood in 20s or 30s, and it causes social embarrassment and leads to a appearance which gives a feminine look, then it becomes a cause of concern for the person and needs treatment on terms of that.
Yeah. So, sound okay? Let us know if the sound is okay. So I think my phone is slightly placed in a particular way. Let us give me a thumbs up, someone, if you can hear us clearly. If you can hear Dr. Sahil clearly, actually. So I always shout at the top of my voice. So just give us a thumbs up if you can hear us. Yeah. And so I think, as Dr. Sahil rightly said, that it's a common problem. And see, most of the infants will have physiological gynecomastia, and in extremes of age it is common. But actually, see, what happens is that when it starts disturbing you psychologically, or you feel that you're not looking your best because of this problem, then people actually come to us for treatments. So I think we can go ahead to explain what is gynecomastia and what it means.
So as I said before, true gynecomastia means enlargement of the breast glands. There's also a term called pseudogynecomastia, which means that the chest appears, a male chest appears feminine, but it has actually excess of fat deposit which gives it the look, and it does not have the breast glands as such. So true gynecomastia basically has 3 grades depending on the size of glands and the excess of skin. So grade 3 is the most severe form, where the chest actually looks like a feminine chest or breast to say, and these are the most severe cases which cause social embarrassment, and actually they cause people not to go outside, meet their peers, or do anything with confidence. And definitely these things, this condition, it needs treatment. People often ask if there is any medical solution to it, but unfortunately in gynecomastia there is no medical solution for it which is permanent cure, and surgery is a single shot answer for the disease. So gynecomastia mein, one thing I'd like to make clear that many people have this thing that surgery is very invasive and recovery is really prolonged. So in a gynecomastia surgery, usually what we need to take care is take care of the excess of fat and take out the gland. The surgery is generally done under IV sedation, preferably at our center. And what we do is first we'll take off the fat with the liposuction. Then we need to take out the gland. So we do that with a subareolar excision. That means we give an incision, which is a very small incision at the junction of your nipple areola skin and the normal skin. And from there we enter and take out whatever excess gland is there. So due to the surgery being done in IV sedation, the recovery is pretty smooth. And if it can also be done as a daycare surgical procedure. If we start early in the morning, then after we need an observation in postoperative period for around 4 hours. And once the patient is well awake, has had something, is walking around, then the patient is fit enough to be discharged the same day itself. In recovery period, what we recommend is usually that a person has to wear a pressure vest to keep the skin in place, to avoid any potential cavity which can lead to collection of any blood or fluids into the space, and also keep the nipple and skin into the place. The closure is usually done by absorbable sutures or stitches. So usually we do not need to take out the stitches. Patient is usually called in follow-ups on 3rd to 5th day, then on the 7th day to see whether the healing process is going well or not. The initial recovery period is around 2 to 3 weeks, but the final recovery, some people ask it like, when can I rejoin the gym? When can I start lifting weights? When can I be absolutely normal? So that period is roughly around 8 to 12 weeks, especially for bodybuilders. We recommend that they wait at least to 8 weeks before starting any strenuous workout and going back to their own regime. It should be at least between 8 to 12 weeks.
Yeah, so yeah, as in for us, what we feel when we do the surgeries, of course we do it under IV sedation.
Yes.
And I think of late, so many patients that we've done, we've never had a patient wake up in pain.
No.
Yeah, so we give good blocks, we give good painkillers, and generally, it's enough
more of
to
a soreness rather than pain.
Yeah, and when the patient actually gets up with no pain, then most likely later on also they are not going to have that pain cycle starting very soon. And most of our patients, we don't see any major issue with pain as such. That's the biggest worry of the patients. Ki, how much pain will I have? Will it be too painful? Will I be able to walk? Will I be able to do my stuff and all? We generally tell them that in 2 days you join office. If at all, if your work does not require any strenuous activity, then in 2 days you can join office. Then you can, keep coming up for follow-up as and when we call you, and follow-ups are also not very tedious in gynecomastia. A lot of patients will ask us, especially, so Dr. Sahil is the one first who sees the gynecomastia patients. And then, then we have a discussion, we examine the patients together. Generally, they will, always pressurize him to write some medications. That doctor, you write some medications so that, this thing can get cured. So that's what I think, what we try to explain to our patients is that this is a local problem.
Yes.
And for any local problem, if you're having medicines, any kind of medicine, see, first of all, there's no treatment, medical treatment for gynecomastia. If at all, first we have to see the genesis, whether it is, let's say, if it is in an extreme case, it's a liver disease or something, that's a different matter. But in general, we are talking about the common gynecomastia that we see. So, see, it's a local problem. And if we are doing anything which is, you have to have medications or if you have to have injections for it, it's going to travel all around your body and
affect the entire body.
It will affect the entire body. So, it's not a very safe way to treat gynecomastia, and it doesn't get treated also. Lot of times people who are deep into the research, they've already had all kinds of medications before they come to us. And believe me, this steroid induced gynecomastia, it's so difficult the gland is so difficult to cut even with the knife. We have to change so many blades when we cut when we deal with steroid-induced gynecomastia. It's a simple healing process. It's a quick 2 hours surgery, quick recovery, and we don't find any reason why a person who is suffering psychologically with gynecomastia should not be resorting to surgical options. If you are not troubled with it psychologically, just forget about it. It's not a medical problem. It is not going to harm your health in any way. And if it doesn't bother you, if you're okay with how you look, might as well not get anything done.
Exactly.
But if it is affecting you psychologically, surgery is the simplest of solutions for gynecomastia. And I think with pseudogynecomastia, we can say perhaps little weight loss.
With little weight loss, workout, those things can actually really help.
Yeah, but again, see, with pseudogynecomastia, we were discussing the other day, Dr. Sahil and me, see, when we are talking about fat deposits, abnormal fat deposits in any part of the body, let's say some person is not happy with the outer thighs, okay, a lot of females come to us with the lateral thighs fat bulge. See, that's your body type. That is where your excess fat deposits.
Exactly.
When you lose weight, it is going to come down slightly, but perhaps maybe still you're not happy with the shape. That is the time when you start thinking about a surgical procedure, a surgical correction, which actually treats the local area. Same with pseudogynecomastia. So maybe if you are not so obese, not so overweight, and still if you have fat deposits in the chest, then it is pseudogynecomastia. You may not be having enough gland in it. But if you feel that still the chest looks heavy, and on ultrasound if we don't find any gland, then a simple liposuction process can also help you, because that is where your fat deposit happens. Yeah, so you have the tendency of it's genetic that you are depositing the fat there. So sometimes not even weight loss helps, because see, for example, you are born with a certain body type, right? It is determined by genetics, it is determined by heredity, that this is your body type. And then if we are wanting to have some changes, then it has to be a surgical intervention. So I think, yes, to classify, we can say gynecomastia, pseudogynecomastia, whatever. But ultimately, if the shape is bothering you, then the treatment for
is surgery.
And it's the same almost.
Yes.
Yeah. I think maybe in pseudogynecomastia we can forego the gland excision.
Yes. If liposuction, it's only just fat, then liposuction can help in contouring.
Yeah, but as far as our experience is, I think there is always some gland. So even in pseudogynecomastia cases also, we'll go in and we'll remove whatever gland we can find. Because earlier in my practice, I've seen patients come back with a little bulge that has been left behind, and
some nodule here and there.
Some nodule here and there keeps disturbing them. So, what we do is we remove gland in all our cases, and we don't leave the scope of any, repeat procedures and all. But I think a little word about young patients getting gynecomastia surgery done, whether it's likely to increase with hormonal change and all. Some young patients, I remember a couple of years back, I operated a teenager, and I think, see, in teenagers we are very clear that, because you see, teenagers are very labile as individuals, and a lot of hormone changes are happening. But many times parents bring them and they'll say that, doctor, he's not going out, he's stopped interacting with his friends, not going swimming, not going to play football, and he's becoming an introvert. He was not like this. So then generally we feel that yes, it might benefit.
Make an exception and actually go ahead with the surgery.
Yeah, we can go ahead. Yes. But I always tell all the teenagers whom I operate that, see, hormone changes are still going to happen, and it's not stabilized. They may have a recurrence when we talk about treating adults with gynecomastia and teenagers with gynecomastia, but it is not necessary that all of them will have it. Some part of the gland we have to leave behind, which is behind the areola portion, and it maintains the blood supply. But again, not very commonly, but when we see that teenagers are actually, they're suffering so much, then the straightforward option is surgery, and there's no reason that we should not be resorting to it, because it's a very straightforward process.
And we've seen it is one of the most underdiagnosed and problems that we have seen in our practice, in
right.
MAM's practice.
So
that there have been patients who have been suffering for a long time, and just because they didn't know what it was, or they didn't know what is happening and what are the solutions to it, they were not able to approach the right people, the right surgeon, or
yeah. But yeah, in teenagers, like in extreme gynecomastia cases, we definitely send them for an endocrine evaluation.
Yes.
So the consultation with an endocrinologist is also important, so that we'll check the hormone levels, we'll check whether other characteristics
underlying any pathology.
Yeah, and other male characteristics are developing well or not, and all. So Pulkit is here, and Pulkit is saying that I have taken steroids. After that, I got that problem. Very common to have gynecomastia post steroid, and it doesn't go back even after they stop the steroids. And if you have it
is something which will need a solution.
Yeah. We have a video on our YouTube channel, and it's especially on bodybuilders gynecomastia, and there I have discussed about what happens in bodybuilders gynecomastia. And actually we are tending to see a lot of patients who are actually actively working out.
And they have a history of either anabolic intake, or they're actively taking it, and then they realize that this is the problem.
Yeah. So thank you so much for joining in this discussion. Thank you, Dr. Sahil. It was good to have you on our live. Dr. Rohit has just joined us. Hi, how are you? And we were just ending our live session. Yeah, so any question? I'll just browse through once.
Pulkit is the one.
Pulkit is the one who's all right. Okay, so I don't see many questions. Okay. Thank you so much for joining us in this live session. And first time in the live session, I don't have any questions about cost. Thank you so much for that. Because yes, I've stopped answering questions about cost. My team is the better, my team is equipped with very good staff, who will actually tell you all the details about the costs and all if you want. And if you are suffering with gynecomastia, seek a consult. That's very important, and it's a treatable condition. It's not a disease, it's a treatable condition. It's not a medical problem. Don't think it's going to turn into cancer or anything. Don't listen to all that. If you feel that it's affecting your confidence, then, it should you should seek help, and professional help, in the sense, you can read a lot on the internet, but you have to take everything with a pinch of salt on the internet. You have to think that when you go to a professional, then actually once we assess, once we see what kind of skin you have, what kind of gland you have, whether you are in good health to get the procedure done or not, then only one can go ahead with the procedure. Dr. Rohit says when you give good treatment, cost is not an issue. I'm sure, I tell people that you don't DM them your details. That is also mentioned on Google. When someone asks about cost, or rather average cost, you don't DM them your details. That is also mentioned on Google. Oh, okay. No, so actually, see, the thing is that our details are everywhere. You can reach us on phone. We would rather have you call us and get the cost details rather than, send it out on DM, because we don't want our messages to be forwarded to a number of people. So you are most welcome to call us on the numbers. I always tell you that you can, and our numbers are everywhere. I tell every time in my live sessions also, 8130134693 and 93154-72650. You can call us on these numbers, and you can see. And again, when I have not examined, when Dr. Sahil has not examined a patient, then we give you an average estimate. Once you meet physically, then obviously, we come to know more about the condition, and then the actual cost can be given. I think that's fair. And I was telling you that when people talk about cost, there's a lot that goes into making a surgery safe, and that the patient must understand that just doing a surgery is not the solution. What happens around it? Who is involved in your care? How we take care of you? What equipments we are using? Everything matters. What kind of post-op care we are giving? There are a lot of things that goes into that go into making a result successful. So it's important for one to realize that everything happens with efforts, and of course cost is an important factor in decisions, and we try to make it affordable for everyone. But as I said, see, these are not emergency surgeries. One can always plan for them, and just have faith in the surgeon with whom you go forward with your surgery. Trust the surgeon, that's very important. And also do your whatever research that you do. And the pictures of patients you share on Instagram are those with permission of the patient who would want to give up privacy for your social media page. Oh, absolutely. We have a separate photo consent that each of our patients sign, and until and unless they sign that, we don't share their pictures on social media. It's very, very clear. We maintain files of the patient, and when they are signing the consent for the surgery, we have a photo consent attached, a separate photo and video consent attached. And they read it up, they sign it, I sign it, and we maintain very diligent records. So it's very important for us. And yes, you are right that who would want to give up privacy for this. But you see, when faces are involved, it's a different matter. But then when body parts are involved, generally, when faces are not involved, then the body is not identifiable. But still, for all our patients, whatever we are doing, whether we are doing a live session with a patient, whether we are sharing their pictures, whether we are making procedure videos, everything involves a due consent form mentioned specifically for what purpose we will use the pictures. Absolutely, there's no doubt about it. So and yes, willingly patients give us consent, and we are very happy about that willingly a lot of patients will give us consents. Patients do tell us, you'll see live sessions with patients where they are very excited for their live sessions, and they'll tell me that, ma'am, we want to go live with you. So I guess we are lucky that patients and we really they trust us, and we're really thankful that they let us share their pictures on the social media. See, that's what, when patients don't give consent for the photo this thing, I always tell them that when they come to me, they'll say that, we want to see before afters, but when we ask them for the consent, they'll say, oh, our privacy. So that's how it is. But yeah, we are happy for the patients who give us consent for the social media platforms. And Pulkit is saying, I will come soon. Okay, Pulkit, see you soon.
Welcome.
Most welcome, yes. And thank you for joining us in the live session. It's always great interacting with all of you, and have a great evening ahead. Thank you. Thank you, Dr. Sahil.
Thank you.
Thank you. Bye.